how to streak a plate. You tap one colony in your plate. So you do that. You streak it, and you're gonna go back in here so you could bring it up. What you want to have is a clear, or rather separate colonies on the plate, so you're able to tell if there are more than one growing, you know. But this won't happen because I'm just transferring one control to the next plate. But that is the reason why you want to streak it out. So you have different plate. You see on top here it's all together, but then when you look over here, it's, you know, the colonies are separate. So you're able to tap into what you want to work up or what you do not want to work up, and you're able to tell which bacteria is which. You can differentiate the colony from the next, and that helps you, you know, identify a bacteria. So, and what you want to do is to keep the plates away from your mouth, because if you're talking into the plate, what's going to happen is it's going to grow what you know, you're breathing out what you're, as you talk, saliva can get on that. So you don't want that. So we want to streak it. It's pretty away from you, and you keep your mouth closed. Basically, that's the best way to go. You usually plate it under the hood, so you know there's a glass in front of your mouth, so you just streak it out. So I'm gonna, this is a Strepiogenes. It's the one you look for in the throat. There you go. And you use one loop for foreign bacteria. And if you don't use loops, you usually use the ones where you have to burn it up. I'm sure if they're using that in classes and stuff, because I use it in my class. And you know, you have to constantly burn it, make sure it's sterilized, that the bacteria you previously used doesn't transfer to the next bacteria you're plating. So you have a clean, specific bacteria growing on each plate. So that's that. That is how you streak it. And if you were to streak, there are two different ways, because you have, let's say you're plating a urine. A urine is usually counted, meaning the colonies are counted. You know, some places they only work up 10,000 and up, some may work under 10,000. So that's another reason why you want to have a clean streak, so you're able to tell how many colonies are growing on a plate. It's an estimation really, but that is the reason why. But it's things like the wounds, you know, stuff as nasal, you know, the strep throat, you don't really count the colonies. What you really want to see is whatever's growing, you're working it up. And of course the streak method is pretty important. That is why you need to do that. As you can see, like this one, you see how you're able to tell different colonies are separate. That is a good streak method. I wish I could show you a terrible one. Sadly I don't. That's an E. coli again. You see that? It's pretty, it's spaced out, so you're able to tell what's what. And that is how you streak. If you were to streak a urine, you usually tap into a urine and you make a single line, and then you go from side to side. Okay, like that. And if you're able to tell, I'm sorry for my lighting is very terrible, but I'm trying. And you know, that's how you're able to tell how many colonies is counting. And over here you work 10,000 or more. You do not work more than 3 bacteria on the plate. That's considered contamination. Contamination happens usually if the patient did not do the procedure properly as he was asked, and we'll have to ask them to do it again. So yeah, that is what you do. These are the plates. I will try to get all the plates that I would have here, and I'll be able to tell the reason why you use what, what to what, you know, differential, selectives, the selective and differential plates like the H and E, and different temperatures that they grow at, and yeah. Okay. Bye.